Keratoconus, the eye disease that tried to take my best vision away from me. But it couldn't get it done. You see, Dr. Brian saved me.
Keratoconus is a condition where the cornea, which is the outer lens of the eye, it bulges out, essentially. And it's uncontrollable, and it can lead to severe vision loss. And in the past, the main treatment for keratoconus was an invasive and painful cornea transplant.
I had two options. Do absolutely nothing and take the wait and see approach, which is risky, or do the CXL in England, which is like 20 miles away in London, which is risky and extremely painful. They even said in their own brochure, pain is usually worse on day 3. Imagine that. So at this point, I literally needed a miracle. And I was like to myself, somehow, some way, maybe in the future, there will be a miracle, a cure, something that is an easier option or a better option. And that miracle I was looking for, I found it. I found a website by the name of Keratoconus Inserts, and I just researched everything, I read everything, I watched doctor interviews.
He had lost his vision to the point that he was legally blind from keratoconus. Well, as soon as we got done, he literally sat up and could see incredible right away.
And I was like, this was the miracle I was waiting for. I had found Dr. Brian.
First treatment that can cure this disease without invasive surgery.
And straight away I sent them an email. The very next day they replied back to me, all the options, all the prices, everything. I knew at that moment this was it. This was it. Nothing else was going to matter, because a CXL and do nothing approach is a risky thing either way. And down the line you may need a cornea transplant, which I don't even want to talk about. And it's those two options were bad either way, and this was the one option called the C3R.
Dr. Brian developed the very first non-invasive, non-surgical corneal cross-linking treatment that does not require removal of a corneal layer and is a 30-minute pain-free outpatient procedure that halts the effects of keratoconus. Called the Holcomb C3R cross-linking system.
So I show up in Hollywood, California, the Legend Hotel. I was only there for a few days, so the next day went to 465 North Roxbury Drive in Beverly Hills. It's like 2 blocks away from Rodeo Drive. It's like right near Rodeo Drive. I remember the Starbucks right next to it, and we finally showed up in the medical building, suite 902. Then we went in for a checkup, checked everything to make sure we would go ahead, and then... Hey guys, I'm here with Dr. Brian Wachler.
Hi everybody.
I came from all the way from UK for the first time in Beverly Hills. Like an 11-hour flight because I wanted to go to the best eye surgeon on the planet. So thank you for this. We're gonna conquer my keratoconus.
So we just went over everything, the discussion. We're going to be doing Holcomb C3R cross-linking, which is the non-invasive or epi-on procedure that I developed back in 2003. So it's coming up on, I guess, 15 years, 16 years. And so our success rate is 99.3% stability with just a single procedure. And it'll be one-day recovery, so it's going to be really easy for you. So what we're going to do is we're going to have a special type of riboflavin solution that we developed that penetrates the epithelium. That's why we don't have to scrape it. And then the procedure itself is going to be about 30 minutes. And then it'll be a little hazy the rest of the day.
Each eye 30 minutes.
We treat both eyes at the same time. Yeah, and you're in a big lounge chair, like a big lazy boy lounge chair. So you're really comfortable. And then you'll go back to the hotel and rest, and we'll see you back in the morning, and you'll be back to your normal routine. You know, you won't have any pain, you won't have any blurry vision or any of those other issues that you get when you have the CXL procedure, where they scrape off the cornea, and it takes a long, long time to recover, and a lot of pain.
And it's risky.
And risks. I mean, you know all that bad stuff. So
alright,
you'll bypass all that.
Yeah. Alright, thank you. The next day, walked in, ready for the treatment. Got everything ready. Riboflavin dropped to numb the eye, 30 minutes, both eyes at the same time. No pain, the slightest discomfort, and then the next day, recovered. Showed up to the building, they checked up everything, and to even the doctor's surprise, the vision somehow got even better than expected. Like, the vision luckily was already good. With a disease like this, the vision was still good somehow. Very lucky for that, but the vision in the right eye apparently got even better. And then here we made this video. Alright guys, yesterday I told you, or 2 days ago I told you I was having treatment for keratoconus. And it's Dr. Brian.
Hi.
And we said we'll see how it goes. I had my trust. And just like we said, everything went perfect, and we cured the keratoconus, or we treated it.
Yep, he's doing great. Yesterday went perfect with the Holcomb C3R cross-linking, and in fact he's seeing a little bit better, in fact. So he's actually even better than my expectations. I couldn't be more happy for you.
Which is amazing. You see, I'm so like, I don't even know what to say in this video. I was like, I feel so like awkward. I was just being so, I don't know what to say, man.
Well, I'm happy for you, myself.
Alright, so anyone has keratoconus, do you know anyone? Bring them here.
And if you want a information kit about keratoconus, and we have a book as well, How We Conquered Keratoconus, you can certainly contact the office. Our website is keratoconusinserts.com. Has all of our contact information there.
I'll leave everything in the description for you guys to make it easy.
Okay.
Alright.
Safe trip home.
Thank you.
You're welcome.
Now you got a YouTube account named WASS.
Ah.
Cool.
Honestly, the treatment was actually kind of fun, not gonna lie. It went easier than I expected. It's simple treatment. It wasn't not pain, slight discomfort, but apart from that, it was pretty fun.
And I have to say that's actually the difference between what we do with Holcomb C3R cross-linking, which is the non-invasive, versus the CXL, which is where they scrape off your cornea surface, and it's painful and long recovery, and it's, well.
So this is pretty painless.
Yeah, this was 100% non-invasive. Yeah, that we developed it, back in 2003, so a long time ago.
15 years ago.
Yeah, we got a long history on it.
So I'm lucky I found this place, because if I didn't, I wouldn't have even gone for any treatment. So good thing I found the C3R. And thanks, man.
You're welcome. You're welcome.
Alright, everything's done.
All done then?
You can go out and have fun now around Los Angeles and go sightseeing.
Yeah.
Lots of fun stuff to do when you're out here.
Yeah. Nice place.
Bye, everybody.